Hi, and welcome to Concussion Talk Podcast, Episode 2. My name is Nick Mercer. In this episode, I'll be talking to a good friend of mine from university, now Doctor of Sports Medicine and concussion expert, Dr. Kristian Goulet. I asked him about concussions in general and what he's seen through his experience and through research. So, without further ado, here is the interview. Okay, I'm on the line with Dr. Kristian Goulet, and he will now tell you who he is and where he works and what he does. So go ahead.
So my name is Kristian Goulet. I'm a physician pediatrician, and I did a sports medicine fellowship, and now I run the Eastern Ontario Concussion Clinic, the CHEO, the Children's Hospital of Eastern Ontario, the big tertiary care in Ottawa. I run their concussion clinic, and I'm the medical director of the Pediatric Sports Medicine Clinic of Ottawa.
Great, thanks. So I guess I'll now just ask you some basic concussion questions. You can give your doctorly advice. Basically, what is a concussion?
So to me, a concussion, it's funny because the true definition isn't not really well known. If you ask
I read your online that presentation. What the presentation you gave an online thing about it. So is that what you consider a concussion?
Yeah, well, I mean, concussions are different things to different people, right? If you get 100 different concussion doctors in a room, you'll get 100 different answers what a concussion is. And to me, a concussion is any change in your mental status after some sort of trauma that's not due to a pre-existing condition or any other external factors.
Okay, so like a stroke can't give you a stroke, but brain drain stroke or same thing. Is that would you consider that type of thing, or
Well,
do
no,
you
I
mean
think
just trauma? You went trauma, right?
Yeah, so for me, it's different. I think if you look at concussions, um, when you talk about something structural, like a structural damage, like whether it's a stroke or whether it's a head bleed, then by definition, it's not really a concussion. A concussion is considered mild traumatic brain injury. When you're
Yeah.
talking about a concussion or a head bleed, then you're talking more of a moderate or
Okay.
a severe brain injury.
Okay. Cool. Well, not cool, but interesting. Uh, so my next question is this: so it's like, what research have you done, and what like in what aspects of concussion have you done research, or do you focus
Right.
on?
Yeah, so a lot of different research. Primarily, I do research on my actually my area of interest is on education and advocacy. I've got some publishings in about doing one study. It's a national study in Canada that's looking for predictors of post-concussion syndrome. So what things should we be measuring when we're looking at concussions and what can be predictive? I have another study that looked at to see if parental anxiety was related to post-concussion syndrome, and we found that it wasn't. We have a study that we're starting now about an education piece, just showing that kids can be taught about concussions, young kids. I did another study with the Sports Legacy Institute about their concussion education piece, and we constructed one and we tested it, and we found that it was a good way to instruct kids. And then I'm going to be having another advocacy piece that's going to make kids into teachers themselves to work on getting them out in the community and having them teach others about concussion.
It's a great idea.
Yeah, so that's what's going to be happening now. Yeah.
That leads actually well. The next question is, what are the common themes of concussion? What do you think these the main common themes are of a concussion?
Well, I think so. I mean, I've seen about 3,000 concussions at this stage too,
Whoa.
and really, yeah, the hallmark is that they're all different, really. So
Yeah.
when you look for common themes, I mean, the one theme you can look for, well, common symptoms being headaches and trouble concentrating and fatigue, photosensitivity, so sensitivity to light, sensitivity to noise. But the thing that I see, I very rarely see the straightforward concussions anymore. I see the more the complex ones. So for kids to see me, they have to get referred from another doctor somewhere in the community. So I see the more complex ones. And what I see with concussions is probably one of the most important things is that the toll that it takes on these kids' lives, right? And
Yeah.
I see kids that, go into depression and go into, stress-related issues, and concussions just has a huge ramifications on the mental
Yeah.
health of kids.
So how? And you mentioned before how would you differentiate that between a concussion and a head injury? Like where acute head injury. What would you
Yeah.
use as your way of
Well,
differentiating
so
that?
concussion is it is a form of head injury. It's a
Yeah.
form
Yeah.
of head injury with a certain set of symptoms after the fact.
Yeah.
We know that concussions. There's a great mystery, a great mystique around concussions that we really don't know what they are. That's the presumption, but we know very well what concussions are on the cellular level. We know that it's just chemicals. It's an abnormality in chemicals in the brain after acceleration or deceleration forces. So your head moves and chemicals get released in your brain,
Yeah.
right? And those chemicals, their lactic acid, their sodium, their gluten, all these different chemicals, right? But we
Yeah.
just know that they are a release of chemicals in your brain, and those chemicals will get released. Now, if the chemicals get released to an extent where it can cause symptoms, whether it be headache, whether it be trouble sleeping, whether it be trouble concentrating, right? That's when it becomes a concussion. So if you get a head injury and you don't
Yeah.
have any of those symptoms, then it's just, it'd be a head injury and it wouldn't be considered a concussion.
Okay. Yeah. So what are like long term effects of just even just one or multiple concussions?
Well, it's yeah. Every person is different. That's the problem, right?
Yeah.
So we expect,
What
if
are the
someone has one, two, sorry,
so what are the common ones? Common.
right? So I mean, everyone is different. I mean, we expect people with a standard, one, two, three concussions,
Yeah.
right?
Yeah.
We expect a full recovery with those,
Yeah.
right? Now, when are you going to start having long-term effects of concussions? Well, we really don't know,
Yeah.
right? It depends on persons. Now, when you talk about concussions and severe head injury, that's a lot different. When you talk about someone that's
Yeah.
had a skull fracture, someone that's had a head bleed, well, that's quite a different story. That's one significant head injury, right, can
Yeah.
have, permanent damage. Whereas with it's a
Yeah.
concussion, we don't expect one single concussion to have irreversible damage.
Oh, okay. And
Does that
like
make sense?
yeah, it all makes sense. Yep. And in the states, and especially in Boston, where you studied too, there's the chronic traumatic encephalopathy.
Yeah. So chronic,
What is that? What is?
good
Give us
question. Yeah.
a brief
So
like.
chronic traumatic encephalopathy, that's the term that we use for essentially abnormal protein being deposited in the brain from repeat head injuries. So someone gets hit in the head over and over and over and over again over many years, you get a protein deposited in your brain,
Mm-hmm.
a protein that is very similar to the Alzheimer protein, right? And that causes some of the problems that you see, very similar to patients with Alzheimer, whether it be memory issues, personality problems, things like Lou Gehrig's disease, Parkinson's. All these different things are starting to be associated with repeat head injury. And the thing is, when you say repeat head injury, you don't necessarily need to have a repeat quote unquote concussion. It's just a repeat head injury that where we call them in the medical world subacute blows. So you look at the offensive and defensive linemen that keeps hitting their head, game
Yeah.
after
Yeah.
game after game that don't necessarily get concussed, but we know that potentially, maybe that these subacute hits can actually take their toll after many years.
Oh, yeah. Oh, yeah. And I've seen that Frontline did a great special on NFL concussions.
Yeah,
Just the tau protein is that what it is? The
the tau protein. Yeah,
tau protein.
exactly.
Yeah. And so that's why. So once you do get a concussion or several, what are the important considerations for managing a concussion for the athlete, the doctor, or the parent?
Mm-hmm. Yeah, so the most important thing with concussions, and this is what I try to hammer home. Hold on one second. Hey, guys.
No problem.
Um, So the most important thing I think with concussions is you have to respect them, right? What I always tell patients are, concussions are like the ocean, right? You have to
Yeah.
respect the ocean, right? But you
Yeah.
can't be terrified of the ocean either, right? So concussions, you have to respect them. So if you get hit in a game or doing an activity, then you immediately have to come out of that activity and reassess, right? So that's when kids run into big problems is when they get one concussion and before their brain is fully recovered, they get hit again. Those are the things that really really set kids back.
And I just lost my sheet there. The question. I gotta get back. I don't know. I don't know. I know. Okay. Oh yeah. So when you get a subconcussive blow, what if you don't know if you're in the kitchen and you bang it on the door, open door? How do you, if you feel later on in the evening, you feel like, is there something you should look for? You feel like you hear, you don't knock yourself out, you don't give yourself what you think is a concussion,
Mm-hmm.
but say like 8 hours later or 5 hours
Mm-hmm.
later, you're laying in bed or sitting down watching TV and you start feeling, what should you look for? What are the main things you know,
Well, good question. Good question. So you're looking, you're looking for, any change essentially in how you feel
yeah,
that can't be attributed to something else, right? So if you get hit in the head,
yeah,
right, but you have the flu,
yeah,
right? I mean, the flu can feel very much like a concussion,
yeah,
right? So you have to rule out other causes of those potential symptoms that you're having, right? So if you get hit in the head, right, and you're sitting 8 hours later, well, you're looking at, you know, you do get a headache. Well, do you normally get a headache or do you not? If you are someone that gets a headache, normally, does this headache differ than the headache that you normally get, right? And if it's the same kind of headache that you got before, well, maybe this is just, a tension headache, or maybe this is one of your migraines. Maybe the headache that you have now has absolutely nothing to do, with the head injury. Now, if you never have headaches and you get hit to the head and you have a headache, right? And those headaches, the key is that they're made worse with exertion, right? So
yeah,
the hallmark of concussive symptoms generally are that they are made worse with exertion. Whether you're physically active, whether you're cognitively active, whether there's too much light, too much noise, whatever the case may be, concussive symptoms should not be random, right? They come on with exertion or exposure.
okay.
Does that make sense?
Yeah, it makes sense. So basically, the treatment does you, except for seeing a doctor, your treatment is rest basically, like rest. And what other treatment can you give yourself, or will doctor recommend for a
So,
concussion?
so there's a good question. So there's a lot of different literature out there, and we know now that cocoon therapy doesn't necessarily work. So shutting kids completely down, putting them on a couch, right?
Yeah,
That doesn't necessarily work. So what I always recommend, right? So you have to control the things that you can control, right? So
yeah,
you make sure that they're eating well. So a protein heavy diet, low fat, low sugar diet, right? For most people, right? Make sure that they're drinking well. Often kids need to drink somewhere between 1 and 2 liters of water a day. Make sure that their sleep schedule is right? So that they're
yeah,
not, you know, napping isn't always a good thing. Now, in the initial phase, it might be, but often you want to get kids sleeping through the night, get a good solid sleep, right?
yeah,
I often encourage kids to go for walks, right? Go outside because when you start making kids feel sick, they start getting sick. So if you stick a kid on the couch all day, right,
yeah.
kid's going to start feeling sluggish and he's going to feel lazy and he's going to have trouble concentrating, right? I
Totally.
tell kids to stay away from screens. So stay away from computers, TVs, cell phones, right? I tell them it's okay to talk to people because you don't want to isolate these people. If you isolate them, they'll start getting depressed, right? So they can talk on the phone, they can have people over at their house and talk, talk with very minimal stimulation, but they need some sort of social interaction, right?
Yeah,
I want kids to not exert too much, right? And then sometimes there are some different supplements that I use, but it depends on the different cases. And for the kids with chronic symptoms, right, there are some medications that I sometimes use as well.
so when you say don't exert yourself, is that what you mean also by like try to keep away from screens because it's too much like mental, you need too much
Yeah,
mental attention
there's too much.
to
Yeah, with
stimulation?
screen
Yeah,
screens are there's too often there's too much stimulation, right? When you
yeah,
talk about anything that's pixelated, you get those little dots coming in from the screen
Right.
at
Okay.
30 and 120 hertz. And so your eyes are constant, your brain is constantly adjusting and readjusting,
Yeah.
right? So that puts a lot of strain on your brain.
Okay. Yeah. No, that makes a lot of sense.
Mm.
So basically,
There
that leads
was a
into.
study, so
Sorry.
there was a study that came out of the University of Wisconsin a few months ago, and it was a short study. It was a relatively small study, but what it showed is that there's no change in outcome by pulling kids out of school for more than 2 days at a time.
Yeah.
So making kids stay home for week after week after week isn't necessarily a good thing.
Well.
Now, I think there's exceptions to that rule, but that just says that you can't completely shut kids down, because when
Yeah.
you shut them down, they won't get better.
Yeah. They feel sick. They'll be sick.
Exactly. There's a
Yeah.
fine line where you have to encourage them to get back to life, but not having them to do too much. And
Yeah.
that's why
Don't.
working with the schools and trying to get them to buy into having these kids go back to school at a very gentle and a very slow pace, and not inundating them with work when they go back to school, but getting them back to school as quickly but as safely as you can is very, very important.
Well, this actually just perfectly leads into a bunch of questions on your clinic in Ottawa. So, what age, like what? So, what do you do basically, and what age are your patients? What age are your patients?
So my patients for headache, so I have two different clinics. One is the Eastern Ontario Concussion Clinic, and that's where I see kids in my private practice, and then I have the concussion clinic that I run at CHEO. Now, both clinics are essentially the same. The one at CHEO, I have a nurse practitioner that works with me. But basically, the interventions are very similar between both places. I see about 3 to 4 often new concussions every day,
Wow.
and I see anywhere from five to 10 follow-up concussions every day, and that's in addition to my pediatric practice. So I do sports medicine and general
Yeah. Right.
pediatrics as
Okay.
well. So it's pretty busy. I
Yeah.
see all patients need a referral. So what will happen is they'll go to either their family doctor, a walk-in clinic, or an ER, and then the doctor will send a referral to me. I try to see all patients within 2 weeks. They'll come in. I'll spend anywhere between 45 minutes to an hour and a half, depending on the severity of the injury. And often we'll do things like blood work, or sometimes we'll do MRIs. Sometimes we'll do other history taking, and more gathering more information. And then with a first appointment, we establish a plan, right? And we educate them. A lot of what we do is we educate both the patients and their families, because we know that the more you educate people, the less likely they are to develop post-concussion symptoms, right? So
Right.
when you take away that mystery, that mystique of concussions, that these kids they get better, right? And when part of what makes concussive symptoms potentially worse is the uncertainty of it all, right? So I spend a lot of time explaining what concussions are, going through with the patient and the families, helping them understand, helping that concussions do get better. You just can't keep hitting your head, and your brain will repair. You just have to give it the opportunity, and then we give them some supplements depending on what the patient is, or sometimes medication. Then we'll see them back a few weeks later, and then we'll reassess and make alterations to the plan as needed.
Okay. Cool. So what range of ages are these kids you see?
Well, as a pediatrician, I can see kids up until their 19th birthday, so I don't see
Okay.
kids after that. But I see kids, essentially
Uh,
from any age. Any doctor that has a kid that hits their head and isn't sure how to manage things, they refer them to me. So, essentially anything from day one of life, if they
yeah.
want, I'll see them.
Wow. She a sports medicine clinic, so there's mostly a lot of overlap between your sports medicine clinic and your concussion clinic. Is there like what sport? I guess hockey, in Ottawa. Hockey is the
Mhm.
main sport.
So hockey, yeah, hockey is probably what I see the most of, just because hockey is
Yeah, it's contact.
it's a cultural thing, right?
Yeah,
Everyone plays hockey, but I see I see every sport. I see, cheerleading and rugby and ringette and basketball and volleyball. And so I do see a lot of, you know, non-sports related head injuries as well
Oh,
too.
okay.
Yeah, no, equestrian. I see a lot of equestrian
Yeah.
concussion.
I was gonna say,
And
are there any sports that surprise you that you see so many concussions coming from the certain sport or?
well, the ones that I found that are they're the ones that kind of worry me the most, right? I think are the ones that, to me, I've seen, some of the most significant head injuries are from equestrian, right? Where you think you have these
Yeah.
horses that are, 16 hands, 17 hands that are huge and are throwing these young people, because there's so much unpredictability with these
Yeah.
animals that can create a lot of force. The other ones where that I see a lot of, long-term symptoms is with cheerleading. Because if you think about it, you get these young girls that are being thrown,
And
15,
you
20
must see
feet in
those
the
a
air.
lot in your sports medicine clinic too, like a lot of like ankles and do you?
Yeah.
Yeah.
Yeah, no, see a lot. Yeah, see a lot of injuries. Yeah, a lot of injuries from those sports.
There's a lot of like the same. The certain athlete comes to you for because they hurt their ankle and then they fell on their head. Did you see a lot of
No,
that or?
no. From the way that it works, I just when either doctors will refer
All right.
a patient to me because they have an ankle injury or because they have a head injury. It's typically not for both.
Do you find the symptoms return a lot? Do like a patient come to you and says, "Oh, I've my the light sensitivity," and then come back and like they say, "Okay, that worked," and they come back like 2 months later and say it's back.
They really shouldn't, right? I mean, because if you look at, the problem with concussions are, when you look at light sensitivity, headaches,
Yeah,
trouble sleeping, trouble concentrating. Well, it could be concussion, but it can be a lot of other things. It
yeah,
could be the fact that they have the flu, the fact that they have mononucleosis, the fact
yeah,
that they have stress.
yeah,
You know, it could be a lot of different things. And if you look at concussions just from a chemical standpoint, right?
yeah.
If the symptoms go away for a long period of time, they shouldn't come back unless you get hit on the head again, right? It's
Okay.
almost it's almost analogous to a bruise, right? If you get a black eye, which is just a bruise, it's blood being released. Your body will resorb that blood. It will take that blood away, right?
Yeah,
It'll take that blood and it turns it from the black eye will go from black to blue to green to yellow, right? And
yeah,
that's your body breaking down that blood and taking it away. The same, and that's just chemicals. The same thing happens in your brain when you have a concussion, right? Your body will take away those chemicals, right? And those chemicals shouldn't come roaring back unless you completely overdo it from an exertional standpoint, or if you get hit in the head again.
okay. Gotcha. So wait, so you see obviously if you see kids under like 18, then they'll be with their parent most likely. So
Yeah,
do the parents' concerns on this and the patient's concerns often align? Do the same concerns?
yeah, they all no, they definitely have a lot of worry. And sometimes the kids come in and they don't want their parents with them, but I always say, no, no, bring your parents in,
Yeah,
right? Because I talk a lot and I
yeah,
give a lot of information, so it's important that they both hear it. Because
yeah,
when we talk about pediatric patients, the parents are a big part of the treatment and big part of the recovery, and they
yeah.
do have a lot of the similar issues. When can they go back to sport? Is it safe to go back to sport? What's the quickest way that they can go get back? But a lot of them just need reassurance too that they will recover from this.
Okay.
So it's a lot of the same questions. Yeah,
So same question between parents and kids.
yeah, very similar ones. Yeah, very similar.
And do you have much follow up? Do you give much follow up? Just see him just once. Or you see him like on a
Yeah,
weekly
no,
basis or
I'll see them through it. So normally I'll see them once, and then the standard generally is I'll give them interventions to make, right? A bunch of different interventions, whether it's supplements, physio, whatever the case may be, and then I'll see them back in about 4 weeks, and then we'll reassess it 4 weeks, and then often I'll see them 4 weeks after that, and then 4 weeks after that, and kind of go that way until they're recovered.
so I've run out of questions actually, but is there anything that you see and that you think are important information about concussions that people should know, like kids especially?
Well, I think the biggest thing is you need really a cultural change, right? You need these kids to inform the coaches, inform the trainers when they get hit and they don't feel right. Because if they pull themselves out of the sport, right, just for that day,
Yeah,
then the probability of them doing significant harm is dramatically reduced, right? It's when those kids they get hit and they don't want to tell anyone because they don't want to be pulled out and they keep playing and they keep playing and they take more hits. That's when you can run into big problems, and that's what kids need to understand more than anything is that it's better to miss that next shift or the rest of the game than it is to miss the next month or 2 months or 4 months, right? Just
right.
because you want to keep playing.
Actually, good because I know you played hockey when I went you, and you still play hockey? Like you still?
I have no. I wish I could, but the practice, my practice is too busy, and then when I'm not working, I'm just with the kids. So
Yeah,
I haven't done
at
much
least
of
well,
anything outside.
but you still watch.
Again, I don't. Yeah, I was never a huge watcher of hockey, right?
No,
But if the Senators are playing or something,
yeah, yeah.
I'll try to watch a period or two. Yeah, when I'm doing my paperwork at the end of the day.
When you were playing hockey when you were younger, did you anything? Do you when you got hit? Would you ever feel like after end of a game or end of a period, end of play, and just feel a bit off? Feel like you've maybe looking back on it,
What's
now what you
it's a
know.
It's a good question. I don't. It's hard to say. I mean, we manage concussions a lot differently, now than we did back
Oh
then.
yeah,
But
yeah,
I know a lot of guys on my team would get hit. They'd come back and they do the smelling salts or something, and then they go back on the ice. Where now is we manage it different. But my dad was a very good hockey player. He was very very accomplished. And he was a tough player too. So he added a couple of fights, but he's never really had, for the amount of hockey that he's played, he's never had any significant concussions. And he said maybe he's had one, and for the amount of
yeah,
hockey that he's played, I mean that's quite remarkable. And
yeah,
I think there might be something genetic with it because
yeah,
I played a good enough fair enough amount of hockey that maybe one time where I got hit and I kind of blacked out, but other than that, I can't really remember too many times where, at the end of the day, I just didn't feel quite right.
yeah. Well, I think that's all the questions I have, Frank. This has been a great interview. Thanks so much, and I would like to thank Dr. Goulet once more for his time and his expertise in a very informative discussion. It was great talking to him again. He was certainly an excellent first guest to have, and I look forward to more podcasts and more guests. So thank you very much for listening, and until next time. The music at the beginning of this podcast is by Ben Sound, www.bensound.com.